Discovering that avoiding masturbation after age 60 could silently erode your physical health, emotional well-being, and sense of identity, not because of societal stigma or moral concerns, but because your body depends on this natural process more than you ever realized. As a urologist with over 35 years of experience treating men across the United States, I've seen vibrant, confident men fathers, grandfathers, and community leaders fade into fatigue, discomfort, and quiet despair simply because they abandoned a biological function they thought was no longer relevant. The truth is undeniable. Stopping masturbation in old age comes with a steep price, affecting your prostate, hormones, mood, circulation, and even your sense of manhood. I'm Dr. James Carter, a men's health specialist, and in this video, I'll uncover 5 critical consequences of giving up masturbation after 60, backed by science and real patient stories. I'll also share practical, shame-free steps to protect your body, mind, and legacy. If you're over 60 or care about someone who is this, could be a life-changing health lesson. Before we begin, please hit the subscribe button and turn on notifications to receive health insights crafted to preserve your vitality and confidence. In the comments, type 1 if this topic speaks to you, or 0 if you'd like me to explore a specific issue to better support your needs. Let's dive into the 5 serious risks older men face when they stop masturbating and the hidden costs that can reshape their lives. 1. Your prostate becomes a silent battleground. I'll never forget Mr. Harold, a 74-year-old widower, sitting across from me in my office, his voice trembling with confusion and frustration. He described a persistent pressure in his lower abdomen, waking up 5 or 6 times a night to urinate, and a nagging pain he couldn't explain. "I thought I was doing the right thing, Dr. Carter," he said softly. "I thought giving it up was what a man my age was supposed to do." Tests revealed a troubling reality. His prostate was inflamed, congested, and on the verge of infection. This isn't an isolated case, it's a pattern I see regularly in my practice. The prostate is a dynamic organ designed to be emptied regularly through ejaculation, whether via sexual intercourse or masturbation. When this process stops due to abstinence, embarrassment, or the belief that it's no longer necessary, prostatic fluids stagnate, the ducts swell, inflammation sets in, and the organ becomes vulnerable to complications. Early signs, such as increased urinary urgency, frequent nighttime bathroom trips, or mild pelvic discomfort, are often dismissed as inevitable aging. But these symptoms can escalate into prostatitis, a painful condition that may require antibiotics, catheterization, or even hospitalization. In severe cases, untreated inflammation can lead to chronic pelvic pain syndrome, bladder dysfunction, or permanent damage to the urinary tract. Another patient, Mr. Thompson, a 70-year-old retired accountant, ignored his symptoms for years, too embarrassed to discuss them. By the time he sought help, he faced a severely enlarged prostate, requiring surgical intervention of fate that might have been avoided with regular ejaculation. Research backs this up. A 2016 study in European Urology found that men who ejaculated 21 times or more per month had a significantly lower risk of prostate issues, including benign prostatic hyperplasia, BPH, and prostate cancer. Ejaculation acts like a natural flush, clearing out stagnant fluids and reducing inflammation. To protect your prostate, aim for safe, regular ejaculation once or twice a week is often sufficient for most men. Pair this with a diet rich in antioxidants like tomatoes and berries, and regular checkups with your urologist, especially if you have a family history of prostate issues. If you experience symptoms like difficulty urinating or pelvic pain, don't delay seeking medical advice. Prostate health is not just about comfort, it's about preserving your dignity and independence. By neglecting this simple, private act, you risk inviting preventable pain and loss. 2. Testosterone declines, stealing your vitality. James, a 68-year-old retired firefighter, walked into my clinic looking like a shadow of his former self. Once strong and proud, he was now exhausted by midday, gaining weight around his midsection and struggling with a loss of drive. "I don't even feel like myself anymore, Dr. Carter," he confessed. Blood tests confirmed my suspicions. His testosterone levels were far below average, resembling those of men a decade older. After losing his wife, James had completely shut down sexually, no intimacy, no masturbation, nothing. He thought it was irrelevant. But the body doesn't agree. Testosterone, the hormone that fuels male energy, confidence, muscle mass, mental clarity, and bone strength, is deeply tied to sexual activity. When a man stops engaging in any form of sexual release, the body interprets this as a signal that reproduction is no longer needed, slowing testosterone production. This decline isn't always immediate, but it's relentless, leading to fatigue, increased body fat, reduced muscle strength, brittle bones, and cognitive fog. The impact isn't just physical, it erodes your sense of identity, leaving you feeling less capable, less driven, and less alive. Another patient, Mr. Alvarez, a 65-year-old former mechanic, experienced similar symptoms. He noticed his workouts were less effective, his mood was flat, and he avoided social gatherings. After resuming moderate masturbation about once a week and adopting lifestyle changes, he regained his energy and enthusiasm for life. Studies, such as those published in the Journal of Sexual Medicine, 2018, show that sexual activity, including masturbation, stimulates the hypothalamic pituitary gonadal axis, helping maintain testosterone levels. This feedback loop keeps your hormonal engine running, supporting not just physical health but emotional resilience. To counteract testosterone decline, incorporate regular balanced masturbation into your routine. Once or twice a week is often enough to stimulate hormone production. Complement this with testosterone-boosting habits. Eat foods rich in zinc, like nuts and shellfish, vitamin D, from sunlight or supplements, and engage in strength training or brisk walking. Avoid excessive alcohol and manage stress through meditation or hobbies. If you feel unusually tired or unmotivated, ask your doctor for a testosterone test to rule out other causes, such as thyroid issues or medication side effects. This isn't about chasing pleasure, it's about preserving the hormonal fuel that keeps you thriving. 3. Emotional balance crumbles without you realizing. Walter, a 68-year-old retiree, married for over 40 years, seemed calm on the surface, but his words revealed deep unrest. "I snap at my wife, I can't focus, and I don't enjoy the little things anymore," he shared quietly, "and I haven't felt the urge in years." This emotional disconnection is more common than you might think. When men stop engaging with their sexual selves, their brain chemistry shifts. Dopamine, the neurotransmitter tied to motivation and pleasure, dwindles. Oxytocin, which fosters bonding and connection, and endorphins, nature's mood enhancers, fade into the background. Over time, this creates a cascade of emotional challenges: irritability, anxiety, and a pervasive sense of emotional flatness. This isn't just about occasional bad days, it affects your relationships and quality of life. You may lose patience with your partner, feel detached from your grandchildren, or struggle to find joy in hobbies you once loved. For example, Mr. Patel, a 71-year-old grandfather, noticed he was withdrawing from family gatherings, feeling hollow despite a fulfilling life. He didn't realize his emotional shift was tied to his complete cessation of sexual activity after retirement. By reintroducing gentle, shame-free masturbation, he restored his emotional balance within weeks. His daughter later shared, "Dad's laughing again, it's like we got him back." The emotional benefits of masturbation stem from its ability to stimulate feel-good chemicals, fostering calm, connection, and resilience. A 2020 study in Sexual Medicine Reviews highlighted that sexual activity, including masturbation, boosts dopamine and oxytocin, reducing stress and improving mood in older adults. To maintain emotional health, try incorporating private masturbation into your routine, even if it's infrequent once a week, can make a difference. Pair this with mindfulness practices like deep breathing, journaling, or spending time in nature to enhance emotional stability. If you notice persistent irritability or low mood, consult a healthcare provider to explore potential causes such as depression or hormonal imbalances. Your emotional well-being is as critical as your physical health. Don't let it slip away unnoticed. 4. Circulation weakens, impacting your entire body. Leonard, a 72-year-old avid gardener, came to me with troubling symptoms: heavy legs, cold hands, and a vague sense of disconnection from his body. "It's not just about sex, Dr. Carter," he said. "I feel off, like my body's not working right." What many men don't realize is that sexual activity, including masturbation, plays a vital role in maintaining pelvic blood flow. This circulation doesn't just support intimacy, it nourishes the vessels that supply your legs, bladder, prostate, and even your brain. When sexual activity stops, blood flow slows, triggering a ripple effect across your cardiovascular system. Reduced pelvic circulation can start with mild erectile dysfunction, but progress to more serious issues: numbness, poor bladder control, and increased risk of heart disease, hypertension, or stroke. Leonard's blood tests showed elevated inflammatory markers, and an ultrasound revealed narrowed arteries in his lower body, signs of circulation loss linked to his complete abstinence after losing his partner. Another patient, Mr. Collins, a 69-year-old cyclist, noticed declining stamina and occasional tingling in his feet. Resuming safe masturbation and adding pelvic floor exercises improved his symptoms, restoring warmth and energy. A 2019 study in the American Journal of Cardiology found that regular sexual activity correlates with better cardiovascular health in older men, likely due to improved blood flow and reduced vascular inflammation. To boost circulation, aim for regular ejaculations or twice a week, combined with light physical activity like walking, swimming, or yoga to enhance blood flow. Stay hydrated, avoid prolonged sitting, and consider pelvic floor exercises like Kegels to strengthen the muscles supporting circulation. If you experience symptoms like leg heaviness, numbness, or erectile difficulties, consult a doctor to assess your vascular health and rule out conditions like peripheral artery disease. Your body's vessels need this natural exercise to stay resilient, ensuring you remain active and connected to your physical self. Number 5. Loss of masculine confidence and identity. Robert, a 79-year-old former teacher, sat in my office during a routine checkup, his eyes reflecting a quiet resignation. "I know this sounds strange, Dr. Carter, but I don't feel like a man anymore," he admitted. This sentiment echoes across many of my patients, regardless of their relationship status. When men disconnect from their sexuality, even privately, it erodes their sense of self. You don't need a partner or active desire to feel this shift. Over time, avoiding masturbation sends a subtle but powerful message to your mind. You're no longer a sexual being, as if your vitality has expired. This loss of confidence manifests in subtle but profound ways: less interest in grooming, reluctance to socialize, or growing self-doubt. Another patient, Mr. Nguyen, a 76-year-old widower, stopped engaging with his body after years of abstinence, feeling invisible to himself and others. This mindset led him to skip routine health checks, downplaying symptoms until a minor issue required hospitalization. Reconnecting with his sexuality through gentle masturbation reignited his sense of worth. "I felt like I had something to offer again," he shared, his humor and spark returning. Similarly, Mr. Rivera, a 73-year-old veteran, found that resuming this private act helped him regain confidence to advocate for his health needs during doctor visits. Reconnecting with your sexuality is about affirming your aliveness, not chasing fantasy. It's a private reminder that you're still capable, still whole, still deserving of dignity. To preserve your confidence, embrace masturbation as an act of self-care, even if it's once a week. Complement this with small acts of self-affirmation, like maintaining a healthy appearance, pursuing hobbies, or joining community groups to stay socially engaged. If you feel disconnected or struggle with self-worth, consider speaking with a counselor or joining a men's support group to address emotional barriers. Your masculine identity is a lifelong asset. Nurture it with kindness and intention. Practical steps to reclaim your health. To help you take action, here's a comprehensive plan to incorporate these insights into your life. Prostate health. Aim for safe ejaculation 1-2 times per week. Eat a prostate-friendly diet with foods like tomatoes, rich in lycopene, walnuts, and green tea. Schedule annual prostate exams, especially if you're over 60 or have a family history of prostate issues. Testosterone support. Combine regular masturbation with testosterone-boosting habits, strength training 2-3 times weekly, adequate sleep 7-8 hours, and foods rich in zinc oysters, pumpkin seeds, and vitamin D, salmon, fortified milk. Consider a blood test if you feel fatigued or unmotivated. Emotional well-being. Practice masturbation as a form of self-care, paired with mindfulness techniques like meditation or journaling to reduce stress. Engage in activities that bring joy, such as hobbies or spending time with loved ones. Seek professional help if you notice persistent mood changes. Circulation boost. Incorporate ejaculation and light exercise, for example, 30-minute walks or yoga, into your routine. Practice pelvic floor exercises, Kegels to strengthen blood flow. Monitor for signs of poor circulation, like cold extremities, and consult a doctor if symptoms persist. Confidence building. Treat masturbation as an act of self-affirmation. Maintain a healthy appearance, stay socially active, and set small personal goals to boost self-esteem. If you feel isolated, explore community groups or therapy to rebuild your sense of purpose. Conclusion: reclaim your power and live fully. After more than 3 decades as a urologist, I've seen countless men believe that aging means surrendering their vitality, strength, and sense of self. The consequences of stopping masturbation after 60 are profound: prostate inflammation, rapid testosterone decline, emotional disconnection, weakened circulation, and a fading sense of manhood. These are not minor sacrifices. They steal your energy, joy, and identity, often mistaken for the inevitable toll of time. But the truth is clear. It's not age that diminishes youth, it's disconnection from your body's natural instincts. Masturbation in your later years is not shameful, frivolous, or childish. It's a vital form of biological, emotional, and hormonal self-care, quiet affirmation that you're still here, still deserving of vitality, intimacy, and respect. The science is compelling, the stories are real, and the choice is yours. It's never too late to reclaim your connection to yourself. Take the first step with courage, not out of obligation, but out of love for the man you are and the life you still have to live. Start today with small, intentional acts, a private moment of self-care, a walk in the fresh air, a visit to your doctor, or a conversation with someone you trust. If this message stirs something in you, that's a sign your inner fire still burns. Don't let it stop here. Type, "I'm still alive," in the comments if you're ready to take control of your health, confidence, and manhood. Subscribe and turn on notifications to never miss another health truth crafted for men like you. Your story isn't over. It's time to write the next chapter with strength and dignity.